Alright, so we shall start with the oral health concern in children with ASD. Dr. Mas actually is going to go deep inside into these topics. I'm just going to show you briefly what are the oral health concerns or what are the oral health situations that we usually see in our ASD children. Okay, so the first photo is actually very common. We call it gingivitis. It is actually an infection or inflammations of the gums, surrounding gums due to deep plaque accumulations. Plaque is actually a food debris. When it stays there for a long period time, sufficient time to make it thick and very difficult to brush, it can affect the gum more than the teeth. So when it starts affecting the gums can be swollen, and this what makes the brushing more agony. And the brushing, when they brush, it can cause bleeding. It's not bleeding definitely comes from the inflamed gingiva. Okay, the inflamed gums. All right. So the lower pictures here is I think the most common things that we see not only in ASD children, also most of the children in the whole wide world is the caries. Okay, and the next one, the below one is the trauma. Trauma is also some of the major concerns that we usually see in children with the ASD because of their hyperactivities, and the majority of ASD, they have a very high threshold pain threshold. So if they fall down, if they knock on something, they very seldom crying. So these are the things that usually happens to them, and most of the time we are at the upper hand to see all this trauma happens. And then the malocclusions is actually the alignment of the tooth is also can be disturbed and impaired. The middle one, I make it a little bit bigger because I think this is the highest issues that I usually receive from parents, which is drooling. They like to play with their salivas, and this can be also a very problematic in the children. Next, the lower one, which is bruxism. Bruxism is actually clenching or grinding your teeth, upper and lower teeth, to that extent it becomes non-vital. It becomes dead on its own. When a child grinds, especially when they are in stress or they don't like certain things that are happening, or there is a changes of behavior or changes of routines, for example, they don't know how to express themselves that they don't like it, or they are in stress, they can usually grind, and to one point it becomes very severe and unstoppable, and it can cause the tooth becomes dead on its own. All right, the next one is actually biting themselves. This is also one of our quite concern, especially when the new teeth comes out, or the changes when the permanent tooth are coming out and the deciduous tooth, the baby tooth, are exfoliating, is going off. This is also some of the things that we usually see. They start to, as if in like teething, but not, teething like the first baby tooth. But when there's the changes of the dentitions, they also started to become agitated, and they might be biting on something, not maybe on themselves, maybe on something foreign body or something hard, just to get rid of the discomfort. The other one is actually this small boy here is eating crayons. We do also have patients who are, this is what we call pica, is actually eating something foreign, just to ease their some of their behaviors. They do eat something. So this is also a certain things that we usually see inside patients' mouth. Dentitions on the anterior parts of the tooth because of biting something hard.